don't take your rights and privileges for granted. They are a privilege, and freedom isn't free, and we have to fight for it.
Some took to the streets Wednesday afternoon as the House took on what President Trump calls the big, beautiful bill. Concern over a multitude of topics, including Medicaid, top of mind for many.
I'm a social worker. I work with people with developmental disabilities, and their home and community-based services are at risk because of all the Medicaid cuts.
It will affect all of us. I have a developmentally delayed brother in Pennsylvania who would lose his Medicaid coverage.
According to the nonpartisan Congressional Budget Office, 11.8 million Americans could become uninsured by 2034 if the bill passes. Overall, federal Medicaid spending would be cut by $1 trillion, with Oregon expected to see a near $23 billion decrease over 10 years.
There's no way to cut this much Medicaid without kicking working people off their insurance.
What this means in Oregon, 1.4 million people rely on the Oregon health plan. All of these people could be impacted, and up to almost 200,000 Oregonians could lose their health care entirely.
Oregon Democratic leaders, including Governor Tina Kotek, spoke Wednesday afternoon, addressing the impacts of the bill.
This budget was inked in greed and not human dignity. I'm not going to pretend that our state budget resources can backfill any of this.
Republicans argue the bill will protect and strengthen Medicaid for those who rely on it while eliminating fraud and waste. And they say the bill includes tax cuts for all, not just the rich.
Make sure people's taxes don't go up tomorrow, the next day, forever.
Despite the narrow Republican majority, Speaker Mike Johnson and others are expressing confidence the bill will get through the House.
A lot of work ahead, but that's the job, so we'll get it done.
Those meetings are having a big impact. Members are moving to yes. Donald Trump is the best closer in the business, and we're going to get it done.
Some of the Medicaid changes, including imposing new work requirements, limiting federal funds to states that offer Medicaid to immigrants, and blocking some parents from enrolling their kids in the Children's Health Insurance Program.
When you've reached a point where you stop supporting people that are in need, when we've reached that point, we're losing our humanity.